peptides, and thymosin alpha 1. Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer care for over 20 years and been in clinical practice for 27 years. The subject of peptides continues to circulate. It seems like it's everywhere. If I go to the grocery store, you'll run into somebody. At the kids' school, you'll run into somebody. Obviously at the office it comes up. You walk in the street at a coffee shop, and it seems like everyone's has this curiosity, is exploring and using it. The one of the first peptides that's in this group that actually I began to use, this was like over 15 years ago, was called Thymosin alpha 1. It's a peptide that has a reputation for supporting the immune system. So historically it was made in the thymus gland, and the thymus has these roles of supporting the immune system. So in China, it's like a drug there. It's called Zadaxin. And so, for example, during COVID-19, it was a popular adjunct that was used. So in my practice, probably like over 15 years ago, there was a patient that came from China with her advanced cancer, and she was using it there and wanted to use it here. And so we required to get special permission from Health Canada through special access, and we were able to attain it. Now that product was really expensive, thousands of dollars, had to be shipped on dry ice, and this was something that potentially helped this person. Move forward to the future, about five or greater years ago, there's this Canada was providing some peptides for use by pharmacies. And so what was amazing was that thymosin alpha 1, from being thousands of dollars, was just like under $100, and you could use a lot more of it because the technology is so easy now to make and cheap to make. Unfortunately, what's happened is because of Health Canada rules and regulations in this gray area, it's like we've been forbidden to use it. And what's happened is that there's a huge underground use of it. So it's typically given by injections, and it's an enormous underground use. And what's unfortunate is these people are doing it on their own. We're not sure of the quality, sterility. And so, government has been more of like, well, we just not into using this, and until we learn more, but yet they're okay with this massive underground use. Personally, I feel there needs to be some sort of like a criteria that government can agree with to the best that they can with all the stakeholders of this exploratory use with all these numerous types of peptides that people are using for all these reasons. So that at least people can use these above ground, be monitored, and ensure that there's quality and sterility factors as well. I know in the US they're starting to take more of a proactive role. And in Canada, this is where innovation comes in, where people become innovative. And because whether you want to ban this or not, the underground use is massive. And you're not going to stop that wave and that interest. So at least what you can try to do is, like, there's groups of them that probably are a bit more possible in using above ground under certain criteria of exploratory or use. And other ones, well, you have to wait a bit more time. But I don't think it's personally right for people to move underground and use these things and on their own accord, and not knowing what's going on or anything about their history, medical history, medications, and all these complexities that can happen. So anyways, so thymosin alpha 1 was one of the original of these groups of peptides that I used 15 years ago as an adjunct, and again, it has this reputation for helping with viral infections. So back then they were talking about it for hepatitis B, hepatitis C, immunogenic cancers like melanoma. And so now it's kind of being used probably in greater context, but But anyways, that was a tool that was low risk and safe when I was allowed to use it, and I was using the original source from a pharmaceutical company. And so here we are in 2026, and these peptides are all over the place, including thymosin alpha 1. And yet, our hands are tied in terms of trying to better help our patients out in this area. And unfortunately, our a lot of patients are going, and a lot of people are going underground.